Welcome back. Our next book takes the lessons of this pandemic and considers what they reveal for the next time the world faces a similar threat. The past 2 years have put new attention on epidemiologists, the public health experts who study patterns and causes of injury and disease. And we have one of them with us here today, the Dean of the Boston University School of Public Health, Dr. Sandro Galea, who has a new book out this month. It's called The Contagion Next Time. Dr. Galea, thank you for being here today. Tell us a little bit more about your background and how you got into this field, and tell us about teaching it to others.
Yeah, thank you for having me. So I'm originally trained as a doctor. I'm trained as a primary care physician, emergency doctor, and I was working in medicine for a few years. And while I was working in medicine, I became interested more and more into thinking, I'm healing people every day. I'm sort of fixing people, making them better. But how do I keep people from getting sick to begin with? And that began my journey in public health. And I went back to school, I got a master's and a doctorate in public health. And through a series of positions, then I ended up here at Boston University, where I have the privilege of being Dean of the School of Public Health. And fundamentally, the message of what I do is to say, how can we create a world that makes us healthy? Not simply treating us when we're sick, but how do we create a world that makes us healthy? And of course, what we saw with the pandemic in the past 2 years is that we don't have that world. And I think this is a really teachable moment, an important moment to ask ourselves the hard question: what do we need to do to stay healthy?
So the title of your book, The Contagion Next Time, it may alarm some people. In fact, it sounds like perhaps a movie title, but it's important that the public is aware. And you don't believe that this will be the last time that we're going to face a pandemic. Why?
Well, a couple of reasons. First of all, let me talk about the title. The title is an homage to James Baldwin's great book, The Fire Next Time. And that book was, of course, a warning and one of the strongest pieces of writing about the influence of racism in America. And I use that because I think racism is one of the many forces that shape the world that we live in that makes us vulnerable to a virus like this. I mean, will there be another pandemic? I don't think any epidemiologist would argue that there will not be. The question is only when, not if, and what kind of virus it is. And I make the point in the book that in some respects we got a bit lucky with this virus, that it was very contagious, but not particularly lethal. And another virus could actually be much more lethal and could cause even more damage. And it's hard to wrap our brain around that with 700,000 deaths, but I think it is an important reality. And I think, I don't mean this in a negative way or in a scaremongering way. I'm just trying to be factual and to say, what are we learning? What should we do better?
In the book, you argue that vaccines, contact tracing, masking, all important, but won't really solve the pandemic that's upon us or prevent future ones. What will?
Absolutely. And again, the book is not an or argument, it's an and argument. We do need vaccines, we need contact tracing, we need surveillance systems. But fundamentally, the reason we lost so many lives is because we were ill prepared to deal with large segments of our society that could not protect itself from the virus. People on low-wage jobs, disproportionately people of color, could not simply work from home. They were exposed to the virus. They were at greater risk of the virus. And a lot of those groups also had underlying illness, which stems from decades and centuries of marginalization. That, of course, intersected with a virus that affected people who have underlying illness and kills people with underlying illness at a much greater rate. All of that means that in order for us to mitigate the consequences of a virus like this, we need to act before a pandemic hits. We need to make sure that everybody has stable housing, livable wages, we have clean air, safe food to eat, safe water to drink, and that we have a society that doesn't have the divisions that made us so vulnerable to these consequences.
And that's really what you're saying, that the economic inequality that exists not only in the country but the world fed the pandemic and made it worse this time.
In fact, I would argue that the pandemic was a triumph of biomedical science, right? We got to vaccines within 8 months of the virus first really hitting the United States, which is an extraordinarily rapid time frame. So we did very well on the medical side of the house. We did terribly, terribly on the social economic structures of our world that predispose us to the virus. I used the line in the book that we were in many ways sitting ducks for this virus. I mean, we as a country live shorter, sicker lives than all other high-income countries. And the virus preyed on that. And we don't want that to happen again. Now is the time for a wake-up call to say, let's make ourselves healthy so we can be resilient to the next pandemic.
From the public health perspective, what are some of the things we need to do? Some manageable things within reach?
Well, I think everything's within reach if we have a radical enough vision. But I would argue that what we need to do is we need to make sure that everybody has access to reasonable education, reasonable housing, reasonable jobs, that we actually do not have violence, that we have safe neighborhoods. Now, I know that the listener might say, well, that's too big, but I would argue that we as a country are getting better. We're consistently getting better. And things that 100 years ago seemed unreachable today are commonplace. I actually think we can get to that vision. And I'm arguing that the pandemic should accelerate our path towards that vision.
So what's another important takeaway you hope people will learn from the pandemic?
I think the key takeaway from the pandemic is that my health and your health are interlinked. Before the pandemic, I think we often had the illusion that says, well, I can buy my own health, I can buy my own sick care, and I may care about your health because I'm a nice person, but really your health doesn't affect mine. The pandemic showed us that, of course, my health and your health are intimately linked, because if you are at risk of the virus, I'm also going to be at greater risk of the virus. And I think that brings us together, and to show that in order for us to be healthy as a world, we need to recognize that health is a shared good. It's a public good, which means it's both the right thing to do and the smart thing to do to care about each other's health. That, to my mind, should focus the mind on saying, what can we do together to create a healthier world?
Dr. Sandro Galea, thank you for being here to tell us about your book, The Contagion Next Time.